I'd like to prod you therapeutically, if I may. Matt White is on the line, environmental psychologist from the University of Exeter Medical School. But before that, I'm going to play you a sound, and I would like to ask you how you feel when you hear this sound. Not so much what you think, but how you feel, what happens inside of you. Here we go. The therapeutic power of the sea, Matt, is that right?
Yeah, we've been looking at this for the last few years now, and there are real effects on people's health, both their mental health and physical health. And I don't think this will come as a great surprise to anyone. What we're trying to do at the medical school is really quantify that to show how much that could save the NHS, for example, in terms of healthcare costs. I mean, Southampton is a good example. It's one of the poorest areas in the country in terms of growth. And yet the health in Southampton and the region around the Solent is better than it should be, in a sense, given the relative deprivation in some regions. So we're trying to understand.
When you say growth,
paradox.
do you mean economic growth?
Economic growth, yes. Yeah. So
right, okay.
Fourth on the worst economic growth in the last 20 years. So why is health not as bad as we might expect? And we're looking at around the country how access to the coast and spending time near the sea is actually a good buffer against relative deprivation.
Okay, so just to unpick that a little bit, Matt, what you're essentially saying is that it is better to be poor and near the coast than poor and in a city.
That's what we find consistently across the UK, and we've got research funding from the European Union to look at these issues around Europe. And not only that, what we found is that that's true of the communities, but what about people who can't get to the coast? Particularly, I'm interested in people in care homes, people in hospital settings. So what we're doing is a systematic program to try and capture some of the benefits people experience at the coast and take them indoors through virtual reality exposure.
How do you know that it's the coast and it's not the fact that you can't build on it? My question sort of is associated to there are lots of care provision and providers in Dorset, Hampshire on the Isle of Wight that are near the coast.
Yeah.
I've visited several myself, and one of the things it's very easy to do is to walk out of that care home with your relative, whoever it may be, walk to the coast, and there is nothing there. It is like an expanse of freedom, it's space. Does it have to be the sea, or is it more to do with the fact that you don't feel pinned in by the world?
Yeah, that's a lovely question. I think that's absolutely true. You've hit a real nail on the head. We also find similar effects with people spending time on places like Dartmoor and so on. Again, that huge expanses. But time and time again, what we find is that what's good about the coast is that it brings people together in a way those other places don't. You tend to be more isolated. You go up there maybe with a partner and so on. What we're finding at the coast is people use it for spending time with friends and family. So you mentioned that yourself in what you just said. So it's the amazing expansive area, but it seems to bring people together as well. And we think that social contact could be absolutely critical.
Virtual reality, I imagine, can have an initial impact. For example, if we were part of a study and everyone listening to this was given those goggles that you put on, the environment was right, a fan was blowing on us, so we had the sort of 4-5D impact of it. That's all very well. But surely, as intelligent adults, we know that it's a shortcut to what should be. Let's just take someone to the coast.
Yeah, I'd agree with that to a large extent. What we're really talking about is those people where it's really very difficult to get out, or it could be a placeholder to say, well, I need some exposure at the moment. Can we go at the weekend and spend some real time there? So I wouldn't say it as a substitute at all. For example, we've just finished a study with dental surgery. Now, you can't do the dentistry out on the beach, but what we found is people are less anxious, less stressed. That's good for their healthcare on the dentist chair, and it's also good for the dentist because the dentist is more relaxed and feels more comfortable about what they're doing. So that's the kind of thing I'm talking about.
So sorry, for the dentistry, you have the sounds of the coast running, or you put them into a virtual reality world and say, just relax, open your mouth. And
the virtual reality world. We actually recreated a beach here in Devon at Wembury, and they could walk around for up to half an hour while the things like they're having the teeth removed. And people said the experience was much nicer and they'd rather do it again. So it's that kind of thing we're looking at.
Yeah, okay. Although again, Matt, I wonder whether that's partly because you've given an extra half an hour of care and comfort to someone, and so it doesn't matter what you do. If you were to give someone an extra half an hour in that session of just saying, look, you're great, here's what we're going to do, rather than a quick 8 minutes in and out, that anything you do would make them feel better.
Yeah, another good question. So we had all sorts of control conditions to rule that possibility out. They could also visit an urban environment, which is actually quite a nice city. You could walk around, look at the trees and so on, go past shops. That didn't have any of the same effects that the coastal environment did with all its sounds. Actually, we weren't allowed to use sounds in the dentist study because the dentist wanted to communicate with the patients. They didn't want them to get so immersed that they weren't listening.
Yes.
But nevertheless, it was the coast one that worked, not the other environments.
Yes, you wouldn't want the dentist about to brief you with, this might scratch a little bit, flanked by a seagull. What was that?
Yeah, exactly.
Yeah, I got you. Just finally then, BlueHealth, I mean, this is all associated with this enormous coastal path scheme. And What are we going to see? What's next on that coastal path horizon? Are we going to see more studies about the therapeutic effects of this? I mean, I imagine most people listening to this will think, of course, the beach is lovely, but having some actual facts and figures is hugely helpful to support the idea.
Yeah, that's exactly it. What we're trying to do ultimately is put a monetary benefit on the health gains, and what we're trying to promote and support is the fact that access to coast for everybody, so that it's not just the wealthy that have access to the best coastline aspects, it's the entire country. And the rest of the world is watching what's happening in the UK. We're actually doing this research in 18 other countries, building on England's sort of innovative, and Wales's innovative coastal path schemes to see if they're going to do similar things in their country. So it's gaining the evidence for other countries as well as not just the UK that this is a good thing.
Matt White, environmental psychologist for University of Exeter Medical School. Thank you very much indeed for joining us on BBC Radio Solent this morning. And you can see some more of that. If you punch in BlueHealth into the normal search engine, there's some quite nice research there looking at this. And it does make you think, well, it made me think a little bit just how fortunate I am to be near the coast. Sadly, when I lived near the coast, I hardly ever went there. Now I'm not so near. I really hanker for it. That's just the way it is.